What's going on, everyone? Happy Wednesday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, April 24th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. And we do talk about a lot of different viruses. As you see, our first story today will be about measles. Want to stay informed? Subscribe to my channel down below. Like this content, give it a thumbs up. Want to help keep other people safe? Share these videos with anyone you know. Got anything to say? Leave a comment down below. Alright, starting off today, we have just a few news stories. Then we're going to take a look at some of our daily data and one state that does update each week on Wednesday. And we'll probably do some wastewater sites in between as well. Not going to be a terribly long pandemic update today, probably around 12 to 13 minutes. That's my guess. We'll see what happens. Health officials confirm measles case in Vermont. Yes, this is Vermont now is reporting a measles case, and it is the state's first confirmed case of measles since 2018. And it sounds like that the health department says it was informed on April 10th by the Georgia State Public Health Department that the group had been exposed to a traveler with measles after their flight into Atlanta. So there's some connections here. There may be some connections to the eclipse. You know, hey, it's been happening. A lot of people travel to and from Vermont during the eclipse. It was bound to happen sooner or later that Vermont would join, I don't want to say party, but would join the boat in the measles that continues to be ongoing in the United States. And I think we will continue to probably see states that pop up with cases that have not seen cases in many years. All right, moving on now to this. This is over in England. A record 3.7 million workers in England will have major illness by 2040. Not the first time we've heard rumors of this possibly being a thing. Here we are again. Health Foundation report also predicts people in poorest areas will be 3 times more likely to die by the age of 70. Wow, that's just terrible. Number one, long COVID's a thing. And number two, not just in England, but all around the world, we need better health care for all, for everyone. It needs to be fair. If someone, who's wealthy, living in a wealthy area, can get good health care, people who are living in not a wealthy area, they deserve good health care as well. I mean, it's something that just needs to be a thing all around the world. Let's read a little bit more. A record 3.7 million workers in England will have a major illness by 2040, according to research. On current trends, 700,000 more working age adults will be living with high healthcare needs or substantial risk of mortality. Yikes. Up nearly 25% from 2019 levels, according to a report by the Health Foundation. Again, this is by 2040. And we do have one more thing to talk about today in news. Loss of smell might persist even 1 year after a COVID-19 infection. I'm not the least bit surprised. I've heard of several people who have lost their sense of taste for several years since their COVID infection and still have not gotten it back. That's right, several years. Remember, COVID started back in 2020. Long COVID is real. Long COVID started soon as people started getting infected in early 2020. In fact, some cases may have started in 2019. Let's be real. Long COVID became a thing. That's right, long before the vaccine started to exist. All right, moving on to this now. Allergies. Yes, it's a bad day for allergies across much of the country. The vast majority of the country is in the moderate orange range, and a large, land-wise, a large coverage area is in the red today, and that includes the midsections of the country, parts of the Great Lakes region, parts of the Rocky Mountains, parts of the I-95 corridor in the east. We were red this morning here in Philadelphia, and I'll tell you what, I've been feeling it today. My eyes have been itchy. If you may notice, my voice is a little bit nasal in the last hour or so. There's nothing I can do about that. And I've taken my allergy medicine today. It's just the pollen levels are so high. Air purifier is a must today if you live in these areas. Mine's going back on the second we finish recording. I probably shouldn't have even turned it off, but it can get noisy sometimes. It would interfere with recording. All right, taking a look at another thing that could be in the air. That's air qualities. Let's see what's going on with that today. Florida, just some minor issues that I've been watching earlier. Not terribly concerned about that. You may see some minor issues also from Raleigh on down North Carolina through South Carolina. You can see here there is some yellows. There is even some oranges along the South Carolina coast. So that's moderate range. That's not good. And our usual hot spots out in the west was Sacramento. Let's zoom into Sacramento. Okay, not too bad in Sacramento, but just here northwest. A little worse than usual today. Did see one site there that is in the purple. Texas, Arkansas, Oklahoma, a few bad sites for you. And look at this, Mexico. For our friends in Mexico, yes, some bad air qualities for you today as well. You may see a few bad air sites here in Pennsylvania. Not seeing it right now, but last night there were some reports of some brush fires that had been going in portions of Pennsylvania. I think those have calmed down, but it's still windy out there, so who knows? There could be a few more brush fires. Taking a look at EMS calls today for Philadelphia, the Tuesday total was 758 EMS incidents. Let's do a live look-in right now at Montgomery County. Yeah, 15 calls right now. I do see a couple respiratory emergencies, seizures, falls, strokes, vomiting, diabetic emergency, dizziness. Yeah, a lot of things going on. And remember, dizziness can be portions of long COVID. Chester County, Pennsylvania. Yes, you're busy for this time of the evening. It is 5:23 in the evening. Injured person, unresponsive person, sick person, falls, lift assist, stroke, falls, lift assist again, heart problems, sick person, falls, and a lot of people falling down. Yikes, that's just not a good thing. And that could be at any age. It happens at any age. Taking a look at Walgreens this week, 13% positivity, which is the same as last week. 4,488 people got tested versus 4,875. That is down for testing, but again, the positivity rate did remain flat. Let's take a look at two wastewater sites, and I'm going to refresh this. That way it's the most up to date. It should be, though, because I did refresh it earlier. We left off yesterday with Oakland, California. Let's see what is going on up near Kansas City, but we'll look in Kansas, state of Kansas itself, because they don't have Kansas, Missouri on here. At least I don't think they do now. 90,000 population at Call Point, Kansas, and you can see here the COVID levels. They are dropping at this time. RSV is dropping. Influenza A is dropping. Influenza B is dropping. It's coming up high, but I'm not really buying that. Norovirus is dropping at this time. Mpox, no detections. And hepatitis A. There have been a few detections of that at this time. Now let's continue. How about we go down to the south and see what is going on in Texas, shall we? How about we come up here to Wichita Falls, Texas, and see what's going on there. COVID levels are low at this time. They are dropping. RSV is dropping at this time. Influenza A is showing signs of dropping. And HMPV still says high, although, take a look here, not many pathogens. That's dropping this time. And norovirus is low at this time. Mpox, I'm not seeing any detections, but there are some detections of hepatitis A. And let's just do one more site. Let's do a bonus site. I want to come over to New Jersey. Let's see what is going on up in, or down in, I should say, Cumberland County, New Jersey. This is Bridgeton, New Jersey. Population of 50,000. COVID is dropping at this time. RSV not an issue. Influenza A, ever so slightly rising. Influenza B is starting to rise again as well. That's rather interesting. HMPV is dropping. Norovirus saw a slight increase. Hepatitis A, not much of an issue, at least recently. Let's take a look here at these dates. Hepatitis, okay, no, it is an issue. This goes back to April 17th. Yep, April 17th. So that was just only about 7 days ago. So hepatitis A is being detected there. Taking a look now at some CDC data. National positivity rate from the CDC is 3.4%. That is down by 0.7%. And when we take a look at epidemic status, it's either stable, uncertain, likely declining, or declining for COVID. And for influenza, it is declining, likely declining, or stable or uncertain in all regions. No state is growing or likely growing for COVID or influenza at this time. Taking a look at the latest variants, we'll get an update on this on Friday. JN.1 is 83.7% of all cases. JN1.13 is 9.1%, JN1.18 is 2.5%, and JN1.16 is at 2.4%. Taking a look at New Jersey, 201 hospitalizations. They are up slightly. On a ventilator, 10 at this time. In the ICU, 24. And discharges, 38. 67 out of 70 hospitals reporting. That's one of the reasons why it's up. And I think they're just bouncing around at this point. I'm not expecting to see a continued rise. It'll probably drop as fast as it went up. At some point, there'll be another wave, but I don't think right now is the time that it is going to start happening. New York State cases, 314 cases added. And when we take a look at New York State hospitalizations, yet again today, they went up ever so slightly. Not anticipating it to translate to anything just yet. Again, like New Jersey, at some point, there will be another wave. I don't think we're there just yet. 464 hospitalizations and 42 people in the ICU. And I did try and look around to see just what caused there to be a rise in New York State. And well, I saw this. The capital region had an ever so slight rise from 13 hospitalizations to 17. Wasn't seeing much of a rise in Western New York, which is really good news. It's dropping there. So the places in New York State that would have potentially seen a surge from the eclipse are not seeing it. Now remember, not all hospitals are testing for COVID on a mission, and the numbers could definitely be higher than we know about, but so far, good news. Taking a look at Colorado. Colorado did see a slight increase as of April 23rd in hospitalizations. They were previously at 77. They're now up to 84. So it went up by 7. Not that big of a deal. This data down below, let me refresh this again. It has not been updating the rest of the data, and I don't know why that is the case. It's saying 524 cases. I don't know if that's actually this week's cases or not. Alrighty, folks, that does it for today's pandemic update. We will have another pandemic update, hopefully again tomorrow. It may be an out in the wild update. If we don't do one tomorrow, it will be on Friday when we get some new CDC data. I kind of have a busy day tomorrow, so we'll just have to wait and see what happens tomorrow. I will see you all again next time, but before I see you again next time, you have to do a few things. First off, give this a thumbs up if you like it. Subscribe down below if you're new, and share this with anyone you know. Leave a comment if you have something to say down below, and of course, the most important thing, stay safe. Remember, I'm on Twitter at COVID Data Report. I'm on Blue Sky as well. I believe that's at Data Report. There'll be a link down below. And my website is datareport.info. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Wednesday evening. Thanks for watching.